Having a healthy family is always important, and having the Alberta Children's Hospital right here in Calgary is another reason why we're very thankful to live here. Right, Tish?
Right.
When you think of the word cure, many of us see it as a goal somewhere in the future. But at the Alberta Children's Hospital, it's more than just an idea, it's a reality. In the 4 years since this facility was built, there have been some incredible developments. Sick children aren't just getting better, many of them are being cured because of the visionary medical team here and generous support from the community. 2.5-year-old Hayden visits the Alberta Children's Hospital every few weeks with her mom and brother, and it's something she doesn't mind at all. Along with her checkups, she often gets to visit with her favorite unit nurses and play with her best friend, Nate. The first 9 months of Hayden's life were spent here, and the fact she's alive and thriving is something her mother calls a true miracle.
I was 18 weeks pregnant when we found out that Hayden was going to be born with a condition. I didn't think it was going to be too serious. They had kind of told us all about how it was going to work, and we thought maybe 6 weeks in the hospital and out we go. But when she was born, we found out that what had happened is her intestines were on the outside of her body, and the small hole they were being pushed outside of started to close and pinched off, and she lost over 90% of her bowel.
It was one of those very difficult worst-case scenarios. From the way her abdomen had formed, she had lost almost all the small bowel, not able to absorb the nutrients, simply not able to get enough nourishment to grow. So without intravenous feeds, she would have perished, she would have died.
15 years ago, this condition was fatal. Just 4 years ago, 72% survived. Since then, 100% of babies born with limited, damaged, or malformed bowels now survive with the help of the intestinal rehabilitation team at the Alberta Children's Hospital.
Our goal for these children is that they more than just survive, but that they thrive, that they eat and drink and play like normal children.
Calgary has become a world leader in treating intestinal failure and formed a collaboration with 18 of the top research hospitals in North America to integrate their work.
With the community support, we've been doing some very exciting research into what controls the function of the bowel. And we hope that we can take that knowledge now and use it as a treatment for babies like Hayden, bring them back to normal life, to eat and drink like normal children.
Hayden's doctors also perfected a new surgical technique called the STEP procedure that lengthens her bowels so more nutrients can be absorbed. After 3 surgeries and breakthrough intravenous feedings, which involved fish oils, she's growing and starting to take more food orally.
Corn on the cob? Can you say it?
Take a big bite.
A big bite.
Having a child diagnosed with cancer is devastating. But why isn't the oncology department at the Alberta Children's Hospital a frightening or depressing place? Because there's real hope here. Just ask Natalie Bazinet and her dad, Mark. Hey, what did you have that brought you to the hospital? Why did you have to come here?
They took a CAT scan of my brain, and then we found out that I had a brain tumor.
Nobody ever thinks it's going to happen to you. It's devastating. It turns your world upside down and just in an instant.
Cancer is the leading cause of death due to disease in children. 1 in 5 kids diagnosed with it dies. And as frightening as that is, when you walk into this place, you know the people here are going to fight to save your child. Once you found out that there was a brain tumor, how were you feeling? What did you think?
I was thinking like, oh my gosh, what am I going to do? How's this going to turn out?
Scary?
Yeah, it was scary at first.
Natalie had total 4 brain surgeries. First one was about 9 hours long. Without question, longest day of our lives. 30 rounds of spinal cranial radiation and 4 aggressive rounds of chemotherapy, all complemented with a stem cell transplant. Your daughter has a life-threatening illness. It's going to be a long, tough road, but you need to make a decision. You decide that as we did as a family, you're going to decide we're going to be positive, we're going to fight this, and we're going to beat cancer.
Your support has helped the Alberta Children's Hospital become nationally recognized for their expertise in caring for kids with cancer. In fact, this hospital is the only children's hospital in Western Canada, and only one of 3 across the country, with the expertise to conduct Phase 1 clinical trials. These involve leading-edge research and test promising new drugs on patients for whom all other treatments have failed. The hospital is also home to the largest blood and marrow transplant center in Western Canada, which was good news to Natalie's family.
The community support has helped us to increase the size of our bone marrow transplant program and the number of children that we serve, kids like Natalie. The community is also funding the research that we're doing that will try to find treatments that can cure more kids and to do so with fewer side effects.
Chemo's definitely something that you really don't like, that you really won't like, because it's not the best thing that could ever happen to you. It's one of the worst things ever that could ever happen to you.
Kids like Natalie would say that their treatment was horrible and they would never ever want to do it again, and we wouldn't want that either. Unfortunately, about 60% of kids who survive cancer treatment do so with a side effect that they carry with them for the rest of their lives. These side effects can range from having difficulty thinking and learning, hearing loss, problems for their lungs, for their heart, for their kidneys. Our goal is to find treatments that increase the cure rates and decrease the side effects. Alberta Children's Hospital strives to be a national and international leader in child health. It has that capability, it has that potential.
So if you had to tell another kid that they had your diagnosis, how would you do that? What would you say to them?
Well, I'd say to them, hey, look, kid, you have cancer, but everything's going to be okay. Everything's going to be all right. Families
say this is the best place you never want to be. Because, of course, none of us ever wants to see a child we love get sick or hurt. The reality is 1 out of every 4 Calgary kids and thousands more across Alberta needs expert care from this hospital each and every year. And thanks to the generosity of this community, they're getting the help they need. But this is just the beginning. With your continued support, our experts will be able to provide even better, more innovative care and cures for our children. If you'd like to find out more about the exceptional work being done here at the Alberta Children's Hospital, or how to get involved, check out childrenshospital.ab.ca.
The hospital team is like a whole nother family of yours that you have never really known about.
I can't thank them enough and don't even have the words to even do that.
The people that do this day in and out, they're angels, they're special people.
It wasn't just that they were taking care of Sarah, they literally helped me heal as well.
Thanks a lot. Thank you.